Good afternoon and welcome to today's Side by Side with the Division of Mental Health, Developmental Disabilities, and Substance Use Services, Improving Our System Together monthly webinar. Before we get started, here are a few reminders about the technology. Please make sure you're using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please make sure your microphone is muted for the duration of the call unless you're speaking or asking questions. Questions can be submitted anytime during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Stillman Bridges and Susan King Lanner. For closed captioning options, select the closed caption feature located on your control panel. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. Today's agenda topics include introductions and MHSU IDD TBI system announcements and updates. Our focus today is North Carolina's transition to Taylor plans. We will get to know the Taylor plans and have a conversation with the chief executive officers. There will also be time for questions after the presentation. At this time, I would like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you so much, Latoya. Hi, everyone. It's Kelly Crosby here, and I'm really, really excited about today's topic. I know I'm excited every month, but I'm really excited today because the CEOs of our LME MCOs are here with us today because today is the official launch day of Tailored Plan. So we're so pleased that they were able to join us today. They're going to answer some questions that we're going to pose to them, but they're also going to answer some questions from you. So hopefully we're going to leave a lot of time for that panel and for some Q&A time. So for those of you that don't know me, my name is Kelly Crosby, and I have the pleasure and the honor of being the director here at the Division of Mental Health, Developmental Disabilities, and Substance Use Services. I've been in this field for an incredibly long time. I am a licensed clinical social worker, and I'm a person with lived experience. And I love this job, and I really appreciate working with y'all. If this is your first time here, thank you for coming. We use these monthly webinars to try to update the field about what's happening in the field, and today's a huge day for us. So really glad our LME MCO partners are here. Next slide, please. So I start these webinars off with some announcements. As a reminder, we have our monthly community collaboration meetings. You'll get these slides, and these tell you the dates of all of our typical meetings. We have our standard meetings with CFAC, LME MCOs, providers, and our hospital behavioral health work group. And we also have our advisory committee meetings for that huge lump sum of money that the General Assembly invested in behavioral health last session. There's a link that you can join any of these meetings. They are all public, and it is our commitment to be as transparent as we can and also to work collaboratively side by side with you as we think about policies and funding for our public mental health substance use, IDD, and TBI system. Next slide, please. Hopefully you're all very aware, and we've been getting lots of comments in, so I thank you for that. Our strategic plan is posted now for public comment. We've previewed it here and in some of our community collaboration meetings. You can scan the QR code and see the strategic plan. It talks about our vision for the system, our goals for the system, and we would love your feedback. I believe that the date ends today. Today's the last day to submit feedback, but it is a living plan. So we're excited to get your feedback. We hope to incorporate all the feedback and post the final document by August the 1st. That is our goal. Next slide. Just a reminder, hopefully folks have been seeing some of those General Assembly investments coming to fruition in the community. So just some of the things that we've talked about here in Side by Side, but some of the things you may have seen in press releases lately, we wanted to lift up. We launched our statewide Peer Warm line. It's going incredibly well, thanks to our partners at Promise Resource Network. We have 5,000 callers a month, and that's in addition to the 8,000 folks that are calling 988. So that's been a smashing success. We also put some investments out for mobile crisis teams and co-responder teams. So those are behavioral health professionals that work with first responders like EMTs and law enforcement. There will be more funding in that space. So please watch for more funding announcements for mobile crisis response teams. We invested $50 million in 9 new behavioral health urgent cares, $22 million in our community crisis centers. We also call those facility-based crises, and a new peer respite in the triangle. And there's just a picture of our most recent ribbon cutting. You'll see Tracy Hayes on there and folks from Alamance County. That was a marvelous celebration of an incredible new facility there in Burlington. So that is just one picture of the many crisis investments that we're working on with our LME MCO partners, with counties, with providers and communities. Very exciting. Next slide. We have a webinar coming up, and please see this as the first of many. We're getting a lot of questions, and we're excited to get those questions about what 1915 iOption services are. So at the department, we are doing another webinar, and we're creating more materials, but the next thing up is a webinar on 1915 iOption services. So these are new services. They're available if you have Medicaid. They're for people with intellectual and developmental disabilities, serious mental illness, SUD, traumatic brain injury. They're for adults and they're for kids. And you'll see on the slide some of them, things like respite services and supported employment, and community living support. So these are like really important community-based services. They are new-ish for Medicaid, but we get a lot of questions about how to access them. And now is a really good time to talk about them as we're moving into tailored plans, because these are exciting new Medicaid services. So we hope that you will join the webinar. There's a hot link in these slides to sign up for the webinar. And please know that we will get as much from you from that webinar, hopefully, as you get from us. Meaning we're going to want your feedback about what made sense, what didn't make sense, where you need more information, what's working and not working for the services, because we want to work with you. We want to work with LME MCOs, with our state Medicaid agency, to make these services more accessible and easier for folks to receive, because we think they're incredibly valuable and we want people to get them. Next slide, please. It is the 2nd anniversary of 988. So we're super, super excited. We highlighted some of our crisis investments a few slides ago, but as of July, we have over 111,000 callers. We get upwards of 7,500 callers a month. We track things like response time, who's calling, what county they're calling from, what age they are, other demographics, and we continue to market. I don't think a week goes by that but our team here, we're not sending each other pictures of 988 signs that we're seeing publicly at grocery stores. I was at the movies this week, and a 988 commercial came up with real live call center staff, and it was very exciting to see. So hopefully we're all getting the word out about 988. Folks are using 988. It is saving lives and it is connecting people to services. So July marks a really exciting date for us in terms of the anniversary of 988. Hopefully y'all look at the dashboard too, because we want to be really transparent about the data that we are seeing and also using that data to build a better crisis response system. Next slide. We also want to announce another webinar that we'll be putting on towards the end of this month. It's a transgenerational trauma webinar, and this is part of our Minority Mental Health Awareness Month programming. So all are welcome. There's the Zoom link to come to that webinar. We're very excited about this one, so please get the word out. We'll be sending it out in Hot Topics, but please sign up for this one. Next slide. All right, so let's talk about the transition to tailored plans a little bit. Next slide, which is really the heart of what we're here today to talk about. So I think you all know, because hopefully you're quite familiar, you see the faces, you know who our LME MCOs are. You know Tracy and Rob and Joy, and I was going to say Rhett, but it's not Rhett any longer. It's Rachel and Libby. You know them, right? You know our LME MCOs. They've been trusted community partners forever. But we wanted to share with you on this slide some information about our LME MCOs, because they are a rich tradition. I was at the I2I conference a few weeks ago, And it was a great time to connect with people. And it was a great time to reflect on our public mental health substance use IDD and TBI system. It is truly a rich system. It is not just steeped in tradition, it's steeped in quality. It is a vast array of services, and there's just so much local community engagement in our services, and our LME MCOs are right in the middle of that. So you all should know we have 4 LME MCOs. That's our local management entity, managed care organizations. They've been managing care forever. So way back in the 1940s, they were area authorities. They used to actually provide services in communities. Folks may remember that. There were a lot more of them. And the look and feel of LME MCOs has changed over time. They used to be area authorities. In 1977, there were some changes to the local authority language. And in 2001, I said that right. In 2001, the LME MCO system began to change in a little bit in the way that it looked and felt. Some of you may know that because you experienced it. Some of you maybe didn't. But LME MCOs began to manage services in their counties, not so much provide them. And so LME MCOs began to look a lot more like they do today. So they're public entities, which is really cool, right? That's part of our secret sauce here in North Carolina. These are public, community-based entities. But they do operate now through Medicaid, like private insurance companies, for public funds, for Medicaid managed care, which is really cool. But they blend together those Medicaid dollars, but also state dollars. So we get General Assembly dollars, federal block grant dollars that come from SAMHSA through our division to LMEs, and also plenty of county dollars as well. So they're a really unique and special type of entity here in North Carolina. And you see some more trajectory. So they became Medicaid managed care entities in 2013. And today they're still Medicaid managed care entities, but now they are operating tailored plans. So in 2013, it was very much about managing the mental health and substance use and innovations waiver benefit, as well as all those county and block grant and state dollars. But now's the really cool part, right? They're full service entities. So they not only manage mental health and substance use and innovation services and TBI services, they also manage physical healthcare services, pharmacy benefits, hospitalization, specialty care, whole person care. And that's really exciting. So we've got these really unique North Carolina specific entities steeped in knowledge and tradition and community relationships, who for years have been honing their skills as managed care companies. And now they'll be overseeing whole person care. So this is a very exciting day for us. Next slide, please. What is a tailored plan? Hopefully you all know by now, and hopefully you recognize this slide. This slide is part of our accessible communications campaign. So just as a reminder, tailored plans are operated by the LMEs we know and love today. Tailored plans are very unique, right, for North Carolina and for Medicaid. So it's just your Medicaid plan if you're a person with a serious mental illness, severe substance use disorder, intellectual or developmental disability, or traumatic brain injury. You're going to get your Medicaid through a tailored plan. And it won't just be for mental health services and substance use services, innovations. It will also be for your medical services as well, and things like care management, and things like non-emergency medical transportation, and things like healthy opportunities, which are other supplemental great benefits, which I'll let the plans talk about. So if you still don't know what tailored plans are, that's okay. There's time to learn. You're going to hear right from the CEOs today, and I'll tell you how to find more information on what a tailored plan is. Next slide. So what you need to know. So this is a good example of information, again, that we published on. Here's what you need to know if you're moving into a tailored plan today. Tailored plans are about you. They're very person-centered, which is really cool. It's about getting all your healthcare in one place. And it also has a very unique service called tailored care management. Everybody in a tailored plan is entitled to tailored care management if they want it. And that's where you get a care manager who can help you put together a plan, a person-centered plan with your goals, and help you connect to different services and also other non-Medicaid paid supports, things that will help you meet your life goals of inclusion in the community, health and well-being, mental wellness, recovery, whatever those goals are. Next slide. I think I'm getting towards the end of my slides, but there's something we really wanted to highlight today. On the next slide, we're going to show you new information that was published on the tailored plans just a couple minutes ago. Well, here it is. So remember, we published a tailored plan toolkit back in April. It was created with our state family and consumer advocacy organizations, with our state CFAC, so that was state and local. That's our advisory committee, or our Consumer and Family Advisory Committee. And the point of it was, how do we have everything from standard PowerPoints to social media kits to one-pagers that we can use as a state, that LME MCOs can use, that consumers can use, that family advocates can use, to help people understand what a tailored plan is. So how can we make easy to understand materials? And what are the most important points? Because tailored plans are quite complex. They're very complex things, right? But at the end of the day, there's very specific things that you need to know. What numbers to call, what things you have to do. And we'll talk about those with the CEOs a bit today. So the Accessible campaign was supposed to be easy, understandable language with some really key points. So the toolkit has been updated because it's a living toolkit. We keep getting information from you all about what else needs to be in it, what needs to be explained. And a new thing that got added is actually a one-page flyer on non-emergency medical transportation, okay? That's a new one. It's an important one. It's really important that folks know that they can get rides, free rides covered by Medicaid to their medical appointments, to mental health appointments, substance use service appointments, innovations, waiver appointments, OT, PT, speech, whatever it is that is covered by your Medicaid benefits. You can get transportation to those services because that can be tricky sometimes, but we want people very much to get to their appointments. So this was a one-pager developed about how you can get transportation to your appointments. Next slide. So next slide was the toolkits. Please share your feedback. There's the QR code. Again, we are always trying to make this communication better and better. Next slide. So now here's what y'all came for, getting to know the tailored plans. So in the next slide, right before I hand this over to Rob Robinson, I get the pleasure of introducing you to the CEOs of our managed care plans. Again, these are our LME MCO CEOs that we know and love. First is Rob Robinson, who's the CEO from Alliance Health. Rachel Porter, who's the Deputy CEO of Partners Health Management. Joy Futrell, who's the CEO of Trillium Health Resources, and Tracy Hayes, who's the CEO of Via Health. And I've had the pleasure of working with all of these folks over many years now, actually, and it truly is a pleasure. They're good folks doing good business. And with that, I'm going to turn things over to Rob Robinson.
Next slide, please. Good afternoon, everyone, and thank you, Kelly. Great job presenting the tailored plan. As always, I really appreciate and value your passion for this work. It definitely comes through. Again, I'm Rob Robinson with Alliance Health, and it is a true pleasure to be here with you on this historic day with the launch of the tailored plans. On behalf of all the LME MCOs, we want to express our excitement and offer thanks to the many for helping the four of us get here today. This includes the state, providers, members, our boards and staff, and everyone else involved for their support, patience, and work to make today a reality. It was certainly a team effort. All right, so I'm going to kick off the LME portion of this presentation by providing an update on our work together. First, here's a tailored plan map, which includes the catchment areas for the four LME MCOs, or now tailored plans. Via, of course, is in the west. Partners is in the middle west. Alliance is the dark blue in the central part of the state, and Trillium's in the greenest color to the east. So we are down to four tailored plans. We have determined that it is important for us to work together to find ways to improve care and make the experience better for members, providers, and stakeholders. The four of us have actually been working together for the past couple of years, primarily focusing on policy and regulatory issues that impact care for everybody. I do want to mention that I am very grateful to be part of this group. My colleagues with me today genuinely care about this work and the people we serve and preserving the public system, which quite frankly always seems to be threatened. One of the things we've done to formalize our work was establish a trade association called the North Carolina Association of Community Health Plans. Dave Richard, the former Deputy Secretary overseeing Medicaid, will serve as the leader of the association. And let's be honest, this was really an easy decision for us, given his experience reputation, and his commitment to the public system. Sarah Wolf DeBose, who we are pleased has joined us, will provide key support to the association. So to our work ahead, as we settle into the Taylor Plan, go live, work out some kinks, in addition to collaborating around policy regulatory topics, we would also like to put more focus on standardization and working with providers, the state, and other stakeholders to make needed changes to improve care and then reduce administrative burden for providers, which I know is what everybody wants. So overall, we are excited about our new trade association and believe it will make a difference in helping us achieve not only our individual goals, but our collective goals. Next slide, please. All right, I'm going to go through this slide rather quickly. It's a little bit duplicative of what Kelly said. I think you know by now, the Taylor Plan is responsible for individuals with severe mental health, severe substance use, those with an intellectual and developmental disability, and individuals with a traumatic brain injury. The number of individuals who are Taylor Plan eligible statewide is approximately 210,000. One of the questions you may have is, what's the difference between the old LME-MCO system, I use old, meaning it's a day old, versus the Taylor Plan? In short, really a lot. Let me hit a couple of the key differences, some that Kelly already mentioned. The big one, of course, is that we will be responsible for whole person care for those who are Taylor Plan eligible, which includes we will now be managing the physical health and pharmaceutical needs of our members. Secondly, I think you're all familiar with this one as well. Taylor Care Management is a service that is only available for members who are Taylor Plan eligible. This service has been in place for now. There are a few kinks to work out, but we're all working on that. If you're not familiar with Taylor Care Management, they are responsible for connecting individuals to needed service. The last point I want to make is care for those with a traumatic brain injury and Medicaid will come under the purview of the Taylor Plan statewide once approval is given by the state. So I'm going to go through this last part real quickly. As a Taylor Plan, we will be responsible for the provision of standard managed care functions. We're responsible for establishing a provider network to include behavioral health, IDD, TBI, and of course now physical health providers. We will monitor and oversee the network and ensure quality services are delivered. We also pay for services, and then we authorize services that meet medical necessity. So again, I did go through that quickly. If you have a question about our role and responsibility, please dump it in the chat and we will do our best to answer that at the end. Next slide, please. All right, now we are in the segment of the presentation when we each take a moment to introduce ourselves and our organizations and talk a little bit about Taylor Plan launch. Here's the catchment area for Alliance Health. We have the privilege of serving individuals and families in a primarily urban environment across 7 counties, largely in the central part of the state, but can't forget Mecklenburg County, which is, a bit southwest. As an organization, we spent several years preparing for today, and the effort to do so was well worth it. This was something we had talked about going almost on 10 years now. And we are very excited for this to come to fruition today. Our board and our staff truly believe the Taylor Plan is the right thing for people, our organizations, and our systems. So a little bit of numbers. Under the Taylor Plan, we'll be responsible for about 60,000 people who are in meet Taylor Plan eligibility. We'll serve another 85,000 who are enrolled with Medicaid Direct. And then we expect to serve around 20,000 individuals who are uninsured utilizing state and county dollars. I do want to mention that while we did go live today, fine-tuning our work will continue as lessons are learned and the kinks worked out. To help ensure that we're successful to begin, we have brought in numerous staff with some incredible experience on the physical health side. We are overstaffed in member services, provider networks, and claims. We have assigned a provider network staff to each of our providers. If you're a provider and you have a question, please reach out to them. If you're not sure who that is, call our member services line. We've also assigned staff, really teams specifically to work with hospitals and health systems. And then we've also established a command center that includes many layers of leadership who are responsible for meeting regularly. To start, we'll meet daily, and we'll do that as long as needed to review and mitigate issues. So we're proud of all of us are proud of getting here today. We prepared to the best of our ability. We feel confident where we are, and we look forward to this tremendous opportunity. If you have questions or concerns, communication is key now. Please call us and let us know what your question or concern is. And even if you want to tell us what's working, we'd love to hear that too. On this slide, of course, is our member services and behavioral health crisis line. So with that, I'm going to stop and turn it over to Rachel. Rachel, take it away.
Thanks, Rob. Thanks so much. I'm Rachel Porter. I'm Partners soon-to-be Deputy CEO, and I'm so happy to be here with all of you today. This is a big day. This is a big day for us and the members and families we serve. We're turning a page to a new chapter for North Carolina's public system of behavioral health and IDD. You know, I thought about earlier today, it really has been 13 years, nearly to the day, where our General Assembly, after a 5-year demonstration pilot, decided to pioneer the decision to create a public behavioral health and IDD managed care system in North Carolina. Pretty visionary stuff. And now, years later, here we are. Even then, Rob mentioned this, even then, many of these visionaries understood that the future was integrated healthcare for the individuals and families we serve. And after years and years of collaboration with our peers, with our communities, with our members, our families, our providers, here we are walking through the door of comprehensive, integrative healthcare for our members and families. I'm pinching myself today. It's been such a long time coming, and we are just thrilled. At Partners, we serve 15 counties, as Rob said, and sort of the western central part of the state. And really, our North Star, our mission is to partner with our members and our families and our providers and communities to improve lives and strengthen communities. That's what we're all about. That's what we're all about. We know that there are going to be bumps in the road. My phone is ringing and pinging. You know, we've had a few of those today. And we truly, as Rob said, have teams and teams of people at the ready to work together with you, hand in hand, to get answers for you and to solve whatever issues we run into. We know there will be issues, and we are ready. We are all poised. We have been since really midnight of last night. And we are sharing with our partner LME MCOs as we go through this process. And so our commitment is to you, first and foremost, our members and our families, and of course, our providers and other members in the community as we go through this transition process. I just want to take a moment to thank the department for the partnership and look forward to the ongoing collaboration. We so appreciate you inviting us here today to answer questions and to meet members and families where they are in this momentous day. And with that, I will pass on to, I think, to Joy. Is it to Joy?
It
Thanks
is.
for having us.
Thank you, Rachel.
You're welcome.
Appreciate it. Good afternoon. As the others have said, it's such an exciting day in North Carolina today to finally be able to move into this tailored plan space. We've been talking about it for a long time. We've been preparing for years and staffing up and those other things that both Rob and Rachel mentioned. And I also want to say thank you so much to everybody on this call, including the department that had a role in that. We've got 46 counties across North Carolina, many of them joining us as a result of a consolidation that happened in January. In our tailored plan, we've got about 75,000 people that moved into that today, and then still about 166,000 in Medicaid Direct. I won't repeat a lot of the things they've said, but like them, we've all been watching with some of our staff starting that around midnight, watching those pharmacy claims come through. So excited to hear a while ago we've paid about 3,000 pharmacy claims for about $500,000. So it's great to watch that work really happen. Those things you prepare so long, and so to really watch a positive launch. And as Rachel said, we'll have bumps. We'll have things that don't go right, but it's so great to see that today people have been able to get those medications that they've been getting, and it's worked. The system is working. Again, it doesn't mean it'll all be perfect. We have staffed up in several areas to make sure as people experience those barriers, those little bumps in the road, that we have people on standby ready to jump on those and get those things fixed. Just say one other thing that I want to make sure is on your radar. We will have a member town hall at Trillium July the 11th at 6 p.m. So if there are any members on this call, write that date down. You can just go to our website and click on that link. You don't have to register anything, because we absolutely want to hear from you all what's working and what's not working as well. You can see those lines that we have. They're staffed up, member and recipient lines, and the dates of those on the slide, along with our 24/7 behavioral health crisis line that has been operational for many years. So please call those numbers. If you need anything, please reach out in our ticket system, because we absolutely want to help you solve your issue. With that, I'll turn it over to Tracy Hayes with VIA.
Good afternoon, everyone. Thank you all so much for joining us, and thank you to Kelly Crosby for giving us this opportunity on launch day to be with all of you. As you can see from the map here, VIA's, we certainly started in the west, but we have moved there into sort of the central north part of North Carolina and towards the east with Vance, Granville, and Franklin counties. So we actually have 32 counties today. That is our footprint in North Carolina. I know Kelly had a slide up there that talked about the history of LME NCOs, and VIA has been around since 1972. We began as an area authority in 1972 in the 7 western counties, and have just continued to grow since then. We are, of course, like everyone else, so excited about launch. I'm gonna share with you what my pharmacy director sent to me earlier today. He said, I was asking him, how are things going with pharmacy? And like Joy said, things are going great. We're processing hundreds of claims. They're going through. But he wrote, today feels so good to finally be doing the job rather than planning to do the job. And I think we all share that feedback and that sentiment. It is really exciting to be off the ground and to have the opportunity to start to improve and impact member outcomes through whole person integrated care. I did see a question in the chat that I thought I would just address quickly. I didn't have time to type it. I saw somebody asking about provider networks, and are we going to be continuing to expand our provider networks? I did just want to share, because this was kind of late breaking for VIA. It got down to the wire with one of our major hospital systems, but we did execute and finalize our contract with the Atrium Health System on Friday. Team worked over the weekend with the department's support to get all of those contract details and members served by Atrium loaded into our systems. We'll be sending out updated member ID cards for anybody whose primary care was Atrium and was not listed on the ID card that they already received. But the good news is that there should not be any gap in care for anybody who has an appointment with an Atrium provider or an Atrium specialist. So very grateful to the folks at Atrium, and very grateful to everyone who helped support making that happen. But like everyone else, our physical health network, our pharmacy network is open, and large chunks of our behavioral health network are open as well. We're always looking for qualified prescribers, psychiatrists, outpatient therapists. There are instructions on our website for how to apply to enroll in our network. Really, the only requirement is that you have to be enrolled in NC Tracks. You have to be in good standing with the North Carolina Medicaid program. But other than that, we are always looking for good providers to join our network. You can see here our member and recipient services line is listed and our behavioral health crisis line. Those are the two most important numbers, but if you go to our website, you will also see that we have a provider support service line dedicated to providers, a nurse advice line, and our pharmacy support line. So all 5 of those call lines are open and taking calls. I think with that, we can move on to the next slide. I think I have 3. Yes, I'm really excited they let me cover this slide. So all of us, all 4 of us have a tremendous connection with our consumer and family advisory committees. All of us have individuals from CFAC who serve on our governing boards. At VIA, we actually have 4 CFAC members serving on our governing board, 1 from each CFAC region. It is incredibly important that we get your feedback. We need to know how services are going from your perspective. We need to know what's working and we need to know what's not working. So please, please don't hesitate. If you'd like to get more involved, visit our website to find out how you can collaborate and go to community events, get involved in free trainings. We offer tons of free trainings in the communities. But you also have the opportunity to apply to participate in our Consumer and Family Advisory Committee, our Human Rights Committee. We have an Innovations Waiver Stakeholders Group. We have a Long-Term Services and Supports Member Advisory Committee. So all of these committees are available to you and folks can apply to participate in those, learn more about our organizations. Our CFAC is very heavily involved. We have CFAC members, for example, who participate in our Quality Improvement Committee, who hear, directly, how are things going at VIA? What does the quality look like? What needs to improve? What could be better? But the big saying, of course, is nothing about us without us. And we support that 10,000%. So please get involved with us. Don't hesitate to reach out. We definitely want your feedback. Next slide. And then this is just one nice summary you can print out and put it somewhere and put it on your fridge if you need. But these are the main contact numbers for our member and recipient services line and our behavioral health crisis line. And the behavioral health crisis line, for those who don't know, because I know Kelly talks a lot about 988, and we totally support and love 988. But 988 is not as embedded locally in our communities as our behavioral health crisis lines. Our behavioral health crisis lines are operating 24 hours a day, 7 days a week, 365 days a year, because crises don't wait for the holidays, right? Holidays is when, in fact, we often have more crises. And folks should feel 100% comfortable to call us anytime. You do not have to be enrolled with us. You don't have to be enrolled in Medicaid to call our crisis line. We will connect you to mobile crisis. We have trained clinicians who are on the line able to answer your questions and help you or help a family member. So please don't hesitate to call our crisis lines if you need help. And I think with that, I am handing it back to Kelly.
All right, thank you all very much. And now I get to ask the CEOs a couple of questions and then we're going to turn it over to the audience. So the first one is for Joy, and I'm old school. I have these down on a piece of paper. So Joy, Rob talked a lot about how today's a really big day and a lot of things are changing. But just to remind folks, a lot of things are actually staying the same. So Joy, what would you say is staying the same about the system?
Absolutely. So much staying the same. Kelly, you shared earlier that history slide. I love that. It just goes back to our roots, our foundation. I like to think of that as we've taken that foundation that we've had for so many years. Rachel referenced almost 12 years ago today was when we began managing Medicaid for those populations that we have today. So we've taken that foundation and just building upon that, these other pieces for those people that are in our tailored plan. So those same services that we've been managing for over 12 years, they're still in our plan. The people in our tailored plan still have access to those services. There's no new rules today around those services. There's no new procedure codes for those new services, no new rates for those services. They are the same. So if you're a provider providing those services, or you're a person that accesses those services, it's the same today as it's always been. We have the same providers out there. We have the same service lines that we've had. You saw those numbers that Tracy just referenced. They're lines that have been operational. They're not brand new today. We have experienced staff on those lines. I'd say probably the only difference in today and 5 days ago, we've probably got a few more staff on those lines, expecting those higher than normal call volumes. CFAC, as Tracy mentioned, we're so glad those consumer family advisory members are still there advising us as they've always had. Kelly, you mentioned Healthy Opportunities. That's still going. It started for us and the people in our plan on May 15th. So those pilots throughout those 33 counties are still moving today so that people can get access to those services offered under those pilots that aren't offered in regular Medicaid. And then the other piece I'll add is with all the testing that we've done, as we've all said, to get ready for today, we all feel like we're in a good place. And I think as we move forward through these next few weeks that you'll see that. The experience I hope we have this week, next week, and over the next weeks will be the part that I hope people will remember years from now. And they'll see that dedication to our members in the rollout of these plans.
Thank you so much for that, Joy. You know, when I call my insurance company, if I have to call about my medical benefits or mental health benefits, I have to call 2 different places. It's wonderful. Like, you know Trillium, you know Alliance, you know Via, you know Partners. You already know if you have issues with mental health or innovation services or whatever, you can call them. Now you can call them if you have issues or questions about your medical services or your prescription. So it's pretty cool. Have one place and one person kind of looking out for everything. I think that's really cool. All right, Tracy, over to you. What are you most excited about for members?
Oh, boy. Well, I think first I just want to acknowledge that change is really hard, and this is monumental change. So I don't want to, I don't want to be too rosy-colored glasses, and I don't want to minimize that. You know, this is hard, and members have been getting tons of things in the mail, right? You've gotten welcome packets, and in fact, you've probably gotten welcome packets. I think we may have even sent out welcome packets months and months ago when we thought we were going to go live in October, right? And you've gotten notifications from the department, and you've gotten all these things in the mail, and I know it can be confusing. Hopefully, for most of you, you are not noticing a huge change from the member perspective. You should be continuing to get the same services you were getting yesterday, Friday. You should continue to be receiving those services from the same provider today and moving forward. That is our goal. What I'm excited about is that for this population, this very historically marginalized population that we have the privilege to serve, people with serious mental illness, people with severe substance use disorder, people with IDD, and people with traumatic brain injury, we now have the opportunity to manage integrated care, whole person care, instead of just looking at, we're going to manage your IDD services, and we're not going to be responsible for making sure you get a physical every year. We're not going to be responsible for making sure that your medications are correct. We're now responsible for managing all of that. And many of us have been preparing for this for a long time and have been doing pilots and other things so that we are really ready out the gate to start to help improve outcomes. I can give you an example of something we've been doing at VIA with our pharmacy team for quite some time, is doing medication reviews. And our pharmacist actually was at our board meeting last week. We try to have folks come and talk about what we've been doing, and shared with the board some of the work that she's been doing on pharmacy to help improve medication reconciliation and medication adherence for people. And one of the things that we're seeing is that sometimes folks are on too many medications, and it's because all the people who are part of their care plan haven't been talking to each other. And so we're really excited about having the responsibility for helping to manage that entire care plan: physical health, pharmacy, specialty providers, IDD, if you have a co-occurring diagnosis, mental health, substance use, all of those things will be managed through one single care plan, rather than having different parts of your care managed by different people, different doctors who don't have the time to communicate with each other. And so we're going to help them communicate with each other so that you can get better care and the right care in the right amount at the right time.
you very much for that, Tracy. And I want to remind folks to please put questions in the chat. And thanks to our LME MCO partners, you've been answering questions as they're coming along. And I hope folks are also paying attention to the chat. There's tons of websites. All the LME MCOs are posting their Taylor Plan websites and their provider directory websites. So please see those resources as well, but feel free to please put your questions in the chat. And now I'm going to ask Rachel a question. So Rachel, Tracy referred to all the materials that folks are getting in the mail. This is very true. So could you give us an overview of materials that people recently received and what should they do with those materials?
Yeah, absolutely. Thank you for that question, Kelly. It might be one of the most important things to sort of focus in on for our members and families. So Tracy mentioned it, and she gave a bit of the laundry list of things that members have received. And maybe the most important thing is the welcome pack. And the welcome pack has all kinds of information that I would really encourage you to take a look at, cover to cover, really. I know that's a little tedious and maybe not in one sitting, but it really does have such important information in there. Additionally, you will have gotten a member card, an ID card, which is different. Typically, ID cards will have come from DSS offices, and this is new. So you might miss it in your welcome pack. Don't miss it this time. Find your member ID card, become familiar with it. If you can, put it in a place where it'll be safe. You'll remember it. You can take it with you to your appointments. But one thing I would ask you to do is to look on that member ID card and check to see about your PCP, your primary care provider, and see if that name looks familiar to you. It probably does, but if it doesn't and you've got concerns about it, do not hesitate to pick up the phone and call our member services line. And this is true for all of us. On the card will be the member services line. And if you've got a question about your PCP, your primary care provider, just call us and we will walk you through it. Additionally, we know there are some PCPs, in fact, we've had, just a handful where doctors retire or move, and maybe you weren't able to get the PCP assignment that you were expecting. Call us and we'll walk you through the process of changing your PCP, which you can do at any time. Just let us know. I will tell you, somebody said this earlier. One of the folks said, we are continuing to work through our contracting with providers. So there are some providers that may not be contracted right now, but may be in the coming days and weeks. If your PCP does decide to contract with us, we will call you. We will let you know, hey, this provider is now back in our network. Would you like to go back to them as your PCP? So be sure to look at that card. The other thing I would invite you to look at is if you have a tailored care manager, there will be information coming to you separately about who that care manager is. Take a look at that as well. That's a very, very important relationship. I think most of us have mentioned the importance of tailored care management. Tracy in particular just did. And that's the quarterback of your care team. That's the person that brings everybody together to work on that plan for you, to communicate about your needs, your specific healthcare needs. And so I'd ask you to take a look at that. More than anything, please do look on your card and in your welcome pack, and certainly on our website, on our member portal. There are all of our numbers. Pick up the phone and call us. There are email addresses to reach us if that's your preference, but don't hesitate to get in touch with us. We are here for you. I said earlier, we really do have teams of people ready to respond to you. So whatever your question, whatever your concern, just reach out to us and we will work with you together to work through whatever the issue is. Thanks, Kelly.
Thank you for that, Rachel. And I noticed in the question, there were a couple folks who said, I got the packet, but not an ID card, or ID card didn't have a physician. So as Rachel said, these PowerPoints have all the numbers you can call for the LMEs. Please reach out to the LME. They're there. We know for a fact Those lines are well staffed because all of our LME MCO partners want to be able to answer folks' questions and really help through this transition time. As Tracy said, transition is hard, but I know our LME MCO partners have really prepared to make sure that staff are ready just to help with anything. Because it might be a little bumpy at first. That's to be expected, but they want to meet your needs, answer your questions, facilitate the change. They absolutely do. So Rob, I'm totally gonna put you on the spot, okay? Rob's like, I didn't have a question. Rob, what would you like the department to do to help to be a good partner to the LME MCOs so that you guys can have a successful launch? Stuff from us. What can we do to help? We want to help.
Kelly, great question. What would I like from the department? So I think some things that we've tackled, that we've talked about internally amongst the LME MCOs is around standardization and reduce administrative burden.
Oh,
And I've shared this before a couple times. I'm a little worried that the system is becoming too prescriptive, that it takes out the flexibility of doing what's right for a member because there's 10 other boxes you have to check over here. And I get the reason for it. Accountability is necessary. We're in a different world. It's as important as ever, but we can't lose the flexibility of doing what's right, being innovative, creative around solutions for members. I think if we can work around that as we go live, as we've demonstrated as LME MCOs that we can operate a tailored plan and we've built that trust among each other, I think we all four of us would love to sit down and talk about how can we standardize and how can we tie this work to outcomes and not to checking boxes. That would be, I think that'd be a great activity for both of us.
I love that. I think we would love to have that conversation. I'll speak for my Medicaid colleagues as well. That's a great idea. And that reducing those check boxes and that prescriptiveness, that flows down to providers too, because we want to free up providers. This should be about care and outcomes, as you said. So I love that, Rob. Thank you for that. All right, I'm going to look in the chat. Elliot, Elliot usually moderates our questions. Elliot, do we have any good ones in the chat?
Yeah, so
Get a lot, and you guys have been answering them. I don't know if you noticed, but the LME MCO staff have just been answering everything. It's amazing. So go for it, Elliot.
No, and there's a chance that if you look into Q&A answered questions, you may be able to see an answer to a question that you have. I also want to call out that I put in the chat information around the Medicaid ombudsman. So if you need confidential advice, you can call the number in the chat. Or go to the email. So for the first question, I'm going to direct it to Rob, but of course any LME can respond. So what effort has your LME MCO undertaken to develop a network of physical health and specialist providers?
You know, I can answer this, but I want to let Sean answer this. He and his team, Sean's over our chief operating officer. He's been developing the network for years now. And it's been a big effort to do so. And they've done a lot of work. Sean, do you want to come on? I'm going to put you on the spot and talk about our work around network development.
Sure. Thanks, Rob. I tried turning on my video. There it is. Yeah, so we've done a lot of recruiting. The first thing, there were some existing large networks of providers in the state. So one of the first activities was go out and contract with these providers that kind of represented literally hundreds of practices. The next, we looked at where members received most of their services and who were the kind of dominant service and physical health providers in our region, and then made really concerted efforts to go and recruit those providers. We built a whole team just specifically to work with the hospitals, since the hospitals provide the majority of specialty care and even primary care in several of our areas. Then we continue to kind of look through claims to understand where people have historically received their services and made ongoing outreach efforts. And we have a team that's continuing to do that today. So for providers, we knew that once we're serving individuals and they may not be in our network today, we just kind of continue to outreach, remind them of the number of Alliance members that are still under their care, and encourage network participation.
Hey, Elliot, could I add to that, please? In addition to what Sean has said, Partners and Trillium have taken a little bit of a different approach, and that is we've partnered with Carolina Complete Health, a standard plan operator, to use their provider network for the physical health side. So everything that Sean just said, all of those efforts we've done in very close partnership with CCH, which has been enlightening and just a terrific partnership going forward. I don't know if Joy would want to add anything to that, but I just did want to point out that we're the four of us are taking different approaches to that build.
Yeah, Elliot, if I can, I'll just add probably a combination of the two. We have used Carolina Complete Health, as Rachel said, but we also spent time really going through those claims, making sure that we had those providers that our members had seen, and that's across all aspects of physical health, to make sure that they're contracted and available for members. And when that's not the case, that we have the tools available to do single case agreements for our members.
Tracy, you want to add anything?
No, I think I'm good. I'm sorry. I've been trying to catch up on the questions in the chat. I'm typing too much.
No, I hear that, and I appreciate all that. Elliot, do you mind if I kind of build off this one? Thank you all for answering that. I know that I hope folks hear the theme here, which is the LME MCOs were really invested in making sure that the tailored plans had very robust physical healthcare networks. They've done a lot, many different strategies to try to make sure that primary care providers, specialists were in network, hospitals were in network. So that was an incredible priority for them. And I hope that you've seen other information published from the state Medicaid agency and from the LME about all the flexibilities that will be in effect for the first 6 months and longer if needed to make sure that folks are still getting services that they need every day. So again, there's a lot in place that our LME MCOs operating tailored plans and our Medicaid agency are doing to make sure that the transition is going to go as smoothly as possible. So we are down to the wire already, and it's time for Dina to do her follow-up. There's never enough time for these. But before Dina does the wrap up, I do want to thank Rob and Joy and Tracy and Rachel for being here today and all of their staff. Thank you so much. Thank you for wanting to be here today. This was their idea, y'all. I want the community to understand that. And we're so excited that they're here. We're grateful to them and their staff for all the work they've been doing for many, many years to get ready for this day. And we welcome them back anytime. Maybe we can do a check-in in 60 days to see how things are going. So truly value your partnership and your leadership in this space. So with that, I'm going to turn things over to Dina to wrap us up. Or maybe it's Latoya. Sorry, Latoya, if it's you.
No worries. If we did not get an opportunity to answer your question during the webinar, questions and feedback are welcome at bhidd.helpcenter@bhhs.nc.gov. The recording and presentation slides for today's event will be posted on our community engagement and training webpage. The links are included in the chat box. There will be a brief survey following today's webinar, and we would appreciate your time completing it. Our next side-by-side webinar is scheduled for Monday, August 5th from 2 to 3 p.m. And we look forward to seeing you then. This concludes our webinar for today. Thank you for attending.